1.
Hi, welcome to Tish Talks, and I'm Tish. Tish Holmes, Program Director for Alzheimer's and Dementia Services of Northern Indiana, a division of Real Services. We focus on programming and education for caregivers of loved ones with Alzheimer's and other dementias. Our motto is helping families right here, right now. Today's topic on Tish Talks is options for keeping your loved one at home for as long as possible. And today our guest is Marcia Namini with Michiana Homecare. Hi Marcia, and welcome.
And thank you so much it is an honor to be here and to communicate. Thank you.
Well, thanks
Thank
for
you.
joining us today. We'd love for you to just tell us a little bit about Michiana Homecare. I know you guys started in Michigan.
We did.
And you've been here across the line in Indiana for a little while now.
We have. We started 10 years ago in Niles, Michigan. Can you believe it?
Wow, and that's a close community.
It is. 10 years ago in Niles, Michigan. And what happened was the owners took it to what we call ACHC accreditation, which is the highest form of accreditation that home cares can have.
Oh, wonderful.
We service everything from just about South Haven all the way down, all the way to New Buffalo, all the way down. And we service all the way over to Edwardsburg, Cassopolis, and then north a bit.
Okay, and then here in Indiana with us.
And just a couple years ago, we started the Indiana branch in Granger.
Okay.
And we are now certified and Medicare approved. So we are running an operation, and we have a full complement of patients in both offices.
Wonderful.
Yeah.
Wonderful. Thank you
Yeah.
for sharing.
Yeah.
So, what services do you all provide?
Well, I'm going to be very clear with this, Tish. We are a medical home health care. What's happened out there is people call themselves home care, and they do it with just the best of heart. But it's a little different to be medical, to be a medical home care. So we provide a wide range of health and social services. We use registered nurses, physical therapists, occupational therapists, speech therapists, social workers. And that's just a beginning of what we can accommodate to our patients all the time. And you wonder sometimes with our agency, patients often wonder, how do you get started with all this? Because so many times people just wonder. Well, I want to be very clear again with this. This is a prescribed physician order to have medical home health care. All right? Yeah.
So that was one of the things I was going to ask.
Yeah.
Do you need anything? So you have to have a doctor's order
Yes,
to
you
get
do.
the skilled clinical care.
Right,
Okay.
right. And what we look at often and what the physician looks at is a change in a medical condition
Okay.
or possibly a recent hospitalization, where then we would go home with the patient and the caregivers, and we would assist them to understand how to care for their family member properly.
Okay.
So a change in condition, what could that mean? It could mean a urinary tract infection, which so frequently our older people do get. It could be multiple falls. And then there would, of course, have to be a reason for the falls. It might be that there's a neuropathy of the feet, other things going on. But we would work at that pretty good to help you out with that.
So when the doctor would know that when he writes the
Doctor
order.
knows
So
that.
we don't have to figure it out. We just let the doctor know, hey, this is what's going on with me, and we have our doctor's visit, and he takes it from there.
That's exactly right.
Okay,
That's
wonderful,
exactly right.
wonderful. So, in order to be eligible, you have to have that clinical need, and a doctor is the one that determines that. So
Right.
you usually have a doctor visit or something first, or you contact your doctor. And then, what are your payment options?
That is an excellent question, because basically Michiana Homecare does that for you. If you will give us the information of your Medicare number, of course your birth date, and of course your name, and we like to have the physician, we go ahead and evaluate whether you're eligible for Medicare services and home care. And we bring that up. It's from the CMS website, and it's very simple, and we do all that work for you, and then we let you know.
Okay, and
Yeah.
CMS, is that something I need to know calling in and asking you to just I need your service. Do I need to know what CMS
That's
is?
a great question. On every one of your Medicare cards, you're going to see Center for Medicare Services.
Okay, and
And
that's
that's what CMS is, if you ever wonder.
Okay, well,
Yeah.
thank you very much. Thank you. So I don't necessarily have to worry about the payment. I'll call you, tell you what I'm looking for, that I have or don't have the doctor's order.
Right.
Then if I don't have the doctor's order, you'll direct me into contacting my doctor. Once that's all established, then I'll let you know and you say, okay, great. I don't have to call my insurance company. You'll do that for me
No.
and let me know.
No, you don't have to call at all. Now, there are many kinds of insurance because some people can have Medicare and some people can have the Advantage Plan of United Healthcare, and they can have multiple forms of insurance. What I'm going to share with you is that if you need home care, let us do the work for you.
Okay.
Let us find out if your insurance or your Medicare covers this and if you're eligible. And we will take totally care of that and communicate with you.
Wonderful. Well, that
Yeah.
right there tells me why I would call you guys for my skilled care needs. I certainly appreciate you sharing that part of it because that's such a big importance, and it takes the burden off of the caregiver and the loved one, that I don't have to figure all this out. I can call you, let you know. You guys will let me know if I qualify for
Exactly.
my insurances to pay and all that. So how do I get in contact with you?
Well, Tish, our number is we have two numbers. We have Niles, and it's 269-687-2900. And then we have their Granger office, and it's 574-318-3900. And Tish has some of our brochures. So if you're thinking that you would like a little bit of help with knowing where our agency is, I'm sure that they could call here if you didn't catch those numbers, and you may be able to share with them the number if they ask for that.
Well, certainly we do have it, and and you can always Google it, but we're going to have you to repeat it right there one
I'm
more time.
going to. One more time. Let's do that. Our phone number is 574-318-3900. And that's for our Granger office because that services a good portion of northern Indiana.
Exactly.
And let's go to our Niles number because people may live over the line. It is area code 269-687-2900. We answer the phone. You're not going to be switched to a caller type situation where there's a tape. We answer the phone directly and we will work with you.
Thank you, Marcia. Thanks so much for being here representing Michiana Homecare.
Okay.
And thank you guys.